Hi everyone, this is Hannah. This is my brief review of synovial joint movement for discussion 3. So let's get started. Flexion versus extension. Flexion is a movement that decreases a joint angle, usually in the sagittal plane. Extension is a movement that straightens a joint and returns a body part to its resting zero position. Flexion and extension are particularly common at the hinge joints, such as the elbow and knee.
Flexion.
An example of flexion would be bending the elbow.
Extension.
Extension would be straightening the elbow. Some examples of flexion in other joints include condylar joints, such as the wrist, and ball and socket joints, such as the shoulder and hip. At the shoulder, moving out of zero position to point at something in front of you and continue that directional arc and point towards the sky. At the hip, it means to raise the thigh, like when you place your foot on the next stair when ascending a flight of stairs. Hyperextension is when a joint is returning to zero position and goes past it. For example, if you were to hold your hand in front of you, palm down, and then raised the back of your hand like you were admiring a ring, that would be hyperextending the wrist. Abduction versus adduction.
Abduction.
Abduction is the movement of a body part in the frontal plane away from the midline of the body. Hyperabduction happens if you raise your arms high enough for them to cross slightly over the front or back of your head, past the midline of the body.
Adduction.
Adduction is the movement of a body part in the frontal plane back toward the midline of the body. Hyperadduction is adduction past zero position. For example, standing with your ankles crossed, crossing your fingers, or standing with your elbows straight and your hands clasped below your waist. Protraction versus retraction. Protraction is the anterior movement of a body part in the transverse plane. Retraction is posterior movement of a body part in the transverse plane.
Protraction.
An example of protraction is reaching in front of you to push a door open.
Retraction.
An example of retraction would be pulling the shoulders back to stand at military attention. Exercises like push-ups, bench presses, or rowing a boat involve repeated protraction and retraction of the shoulders. Circumduction.
Circumduction.
With circumduction, one end of the appendage remains fairly stationary while the other end makes a circular motion. Rotation is a movement in which a bone spins on its longitudinal axis.
Rotation.
In this example, moving the forearm to place the palm against the abdomen spins the humerus in a motion called medial internal rotation. The opposite movement, so the forearm points away from the body, would be called lateral external rotation. Another example of lateral rotation would be a ballet dancer in first position. Another example of medial rotation would be standing pigeon-toed or with the toes pointed inward. Supination versus pronation. Supination is a movement that turns the palm to face anteriorly or upward. Pronation is when the palm moves to face posteriorly or downward.
Supination.
In anatomical position, the forearm is supinated.
Pronation.
Dorsiflexion versus plantar flexion. These are special movements of the foot where dorsiflexion means toes elevated and plantar flexion means toes point downward.
Dorsiflexion.
When walking, your foot dorsiflexes as it comes forward, which results in the characteristic heel strike of human locomotion.
Plantar flexion.
An example of plantar flexion would be standing on tiptoes. This concludes my discussion 3 review of synovial joint movement. Thanks for watching.